Any parent of young children right now is facing a dilemma that has gone from bad to worse over the last few years. The cost of childcare is increasingly out of reach. To explore this topic with us this morning are Shannon Tremblay from the New Hampshire Child Care Advisory Council and Melissa Caldwell from the Seacoast Community School, the executive director there. Ladies, thank you for joining us this morning.
Thanks for having us.
So Shannon, let's start with you. You know, this has been a persistent problem for many years now, but how much worse has it become in this post-pandemic era?
It just continues to keep getting worse. You know, we're losing workforce at a tremendous rate. They're just not getting paid enough. There are classrooms that we have to close. Providers aren't able to get anyone coming in, even for an interview. It's really difficult. And parents, you know, are obviously losing work because of it. Yeah,
Melissa, you're stuck in a rock and a hard place on the ground on the front lines of this, right? Because you want to offer an affordable service, but you have to pay your people, and it's just tough. So just take us through on a day-to-day basis the problems you're facing.
So I think for us, for Seacoast Community School, we're lucky in the fact that we are a larger center, so that we're able to look at things and offer services and benefits that maybe some other small scale or at home can't. But even with that, we look at trying to aim for 90% of our budget to be covered by tuition. And then from there, we have to fundraise or look for grants, and all of those pieces combined together. If there's not that money there, then we have to look at more money coming from tuition, which then just passes it along to our families. So we're in this vicious cycle of looking at the people that we're asking for money are the people who are already paying us money, and even those high rates that we're looking aren't covering things like livable wage or benefits for our staff.
Right, and so many parents are looking at this now at the cost and just saying, gosh, it's almost easier to stay home. So it's difficult on that front as well. You know, Shannon, there's been a lot of policy work done on creating pipelines from the community colleges to the daycares and preschools to be able to have that workforce, but it's not an overnight solution. Explain what's going on there.
Right, I mean, that takes time. You know, one, you have to get the students into the classrooms to take the courses, and then they have to take the courses, which could be a 2-year program, and then it takes that amount of time just to get them into being qualified to be able to come into the center and take on babies and kiddos.
Yeah, and explain the wage issue and difficulty there, of how that is a problem.
Yeah, I mean, no one wants to come in and making $15.43 an hour, I think is now the average, and without benefits, you know, because a lot of these centers, Melissa's center is able to give benefits, which is unlike a lot of other centers. It's just too expensive to cover, and they're small staff. They only have, you know, maybe 5 staff members or 10 staff members, and that doesn't constitute enough money to be able to get benefits.
And Melissa, on the funding front, you know, we've heard a lot about federal cuts, and they're big and they're across the board. Does any of that hit the child care sector, and how does that affect what you're doing?
Yeah, for sure, and in lots of different ways. I think there are things like looking at federal pieces around nutrition could then impact the CACFP issues, which then impacts if you are large enough to be able to access that program. It's not going to be reliable or sustainable. But then I also think that there's more people that are looking at certain federal funding sources or grants or private donors. So you're getting more people looking at the same pool of money. So it's becoming more competitive, so there's less money there. But also like different pieces of it are becoming less reliable. So if we used to think that we could get this much welfare money, we might not be able to receive that anymore because more agencies or more different areas are looking towards that same funding source from the city, the state, or the federal government.
And Shannon, more on the workforce front there, and I forgot to ask about this, you know, the wages are such that it's tough for, if these are moms, they might not be able to afford the child care that they're providing. That's bizarre.
Yeah, a lot of the workforce is on state subsidies, and has made, you know, with the child care scholarship, they're the ones that are taking a lot of the scholarship. We need to ensure that they're able to take their children, you know, to take their children to work with them. It's actually how I got into early childhood myself. I was able to take my own kiddos with me, and that was a huge benefit. But you know, if they're just above that income cap, then they're not going to be able to take that scholarship.
Right.
Yeah, we had 100. Yeah, I was going to say we had 100% of our staff qualify for the state scholarship program to be able to get state assistance for their tuition covering. Our school is in a position where we're able to add in additional benefits that go along with that, but not every place is. But it shows if 100% of our staff applied for state scholarship and got awarded it in some fashion, like that means that it's not a livable wage, and that they're all hovering in that low to medium, you know, poverty level, or. So it's a problem.
If they don't have a spouse, you know, that's able to make a little bit more money, then, you know, if it's a single mom or a single dad working at a child care center, it's not going to be sustainable for that family.
And just when you think you might have the right balance, the cost of living starts to tick upwards again, and it's a problem again, right?
Right.
Yeah.
So the space versus staffing issue, I know that's a big part of the discussion here, but also we can touch on that with Melissa. Also, this trend of larger businesses deciding to just open their own child care center on the inside. What's going on that front?
So it looks like, you know, people are seeming to think that if we just a certain business opened their own center, that would be the then answer, so that their employees could have their people, you know, send their child there. But really what it is, it's not a space issue, it's a capacity and qualified staff issue. So what we need are qualified staff to staff the rooms. We need partnerships between the business world and the child care world, so that we can take the existing space, staff it, be able to hire staff, increase wages, increase benefits, so that's more desirable, so that we have a better pipeline. We can build the already closed rooms or expand our spaces from people that are knowledgeable about the world of early childhood and are looking at it through an education lens and not just a capacity lens for their business.
And what are some of the potential solutions here, Shannon? When you're stuck on either side of those business pressures, what is able to help you make sure that you can keep that workforce at perhaps a little bit higher wage?
You know, business investment. For so long, the child care community has kind of taken the business aspect of it and has really, you know, supported the businesses. It's time for the businesses to support us now by, you know, increasing business fees or taxes. I know we don't like to say the word taxes in New Hampshire, but, you know, we need to have those reliable revenue sources, and the business community needs to start to pay a little bit more and to help us, you know, get our wages up to where they're sustainable. On a
state-by-state comparison basis, in terms of New Hampshire's investment in this level of early childhood education, where do we stand in New Hampshire?
We're one of the lowest states, actually, with state investment. Which is kind of shocking because we're not. I mean, we're a pretty rich state as far as revenues, and but we are one of the lowest, which is shocking to me when I heard it.
Melissa, what are your thoughts on the regulatory burden? Obviously, the state has oversight of what's going on in a lot of these schools and daycares. Would it help at all if that was less?
Well, I think it becomes more about what the regulations are, and then being able to put the people who that know or now are on the ground with them to be the people who are the point people or the people that are being asked the questions, and that legislation's not just being made by people who aren't there with children. If you think about looking at deregulation, I know there's a lot of conversation around, should we up class sizes, should we have more kids in there, and really, if you've ever been in an infant classroom where there's one adult with 4 babies or 2 adults and 8 babies, that's a lot. And so being able to say that you can put 10 children in there, and that isn't necessarily the answer, not if you're looking for high quality care and looking for those children to have all of their needs met in a safe way. And that's kind of what we pride ourselves in doing, is making sure that we have a safe, secure place where basic needs are met, food is given, and that those child are thriving and growing throughout the day. Just being able to have from a number numbers perspective, yes, upping certain things would be an easy answer, but it's not. The reality and the quality is going to go down. The care will go down if we continue to just throw numbers and pieces at it. We need to look at it from a care and education stance, not just at a business stance, but those two worlds need to come together and partner so we can all move together with, answers and in a problem-solving kind of way.
One adult with 4 infants. Good luck to anyone in that situation.
Yeah,
It's tough enough for me with one.
Yeah.
But Melissa Caldwell and Shannon Tremblay, thank you so much for your perspective. We appreciate it.
Thank you
Thanks.
very much.